Hello, I am Dr. Mirela Cernăianu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hello, listener. Thank you for joining me today on discussing and learning facts about progesterone. This is the second most important sex hormone in your body if you're a woman. Why do I want to talk about progesterone? Because it's extremely important. It's a major master hormone that's a very, very, very valued protector for a lot of things caused by estrogen. It doesn't mean estrogen is bad. Estrogen is absolutely awesome, but estrogen is only awesome with its own sidekick, progesterone. I will divide this topic into 2 episodes, part 1 and part 2. So we will continue in episode 5. And you might be thinking, lady, you're crazy. You want to talk about progesterone for 2 episodes? I do. It is that important. So please listen. As a woman, you should have the majority of your ovarian cycles make progesterone alongside estrogen, because having normal, healthy amount of progesterone produced by a woman's body, it's a sign of great health, fertility, and a good sex hormone balance. In this podcast, what I'd like to do is explain how we make progesterone, why we bleed regularly, why is it important that we bleed regularly. I will also discuss causes of estrogen dominance, and we touched upon that a little bit in the previous estrogen excess episode. And what can we do to address estrogen dominance? So I didn't leave you hanging with the estrogen dominance from last episode. In progesterone part 2, the next episode, I will discuss more on how women menstruate, the exact mechanism. I will approach and discuss and inform you on when to test your sex hormones, specifically estrogen and progesterone. I will discuss whether we need progesterone after menopause or not, and the difference between natural bioidentical progesterone and synthetic progestins. Why modern medicine uses progestins, and why your doctor might choose to prescribe a progestin instead of progesterone. So let's get started. Progesterone is naturally made in the body in 2 places, the ovary and the adrenal. The progesterone made in the ovary is the one that counts and matters to balance the estrogen. The largest amount of progesterone, it's actually made by the ovary and only for 10 to 14 days out of the month every cycle. Obviously, when I say cycle, I clearly refer to a woman's cycling, where a bunch of follicles are recruited. One of them becomes the dominant one. It grows. It makes a lot of estrogen. Ovulation happens. The egg that ovulated is transformed into a corpus luteum that makes the progesterone to sustain a possible pregnancy. Pregnancy doesn't happen. The lining sheds. Boom, the cycle starts all over again. If that's not clear, because I went very fast, let me repeat it and go slower. First, you get a period. The period lasts a few days. This is the start of the cycle. Then you enter the follicular phase, where your body selects anywhere from 2 to 20 follicles in each cycle. One of these will grow, will become dominant, and it will make a lot of estrogen. This follicle will ovulate after 10 to 20 days. That is the peak of follicular phase called ovulation. This dominant follicle will release the egg that normally is captured by the tube. This is the culmination of a cycle, and it means a woman is fertile and able to have children. After ovulation, the follicle that released the egg becomes what we call corpus luteum. And a woman now enters the luteal phase, the second part of the cycle, which lasts anywhere from 10 to 14 days. And depending on the quality of the egg and the level of the estrogen, the corpus luteum will make a certain amount of progesterone. One of the things that's not really clear or taught or explained to women is that the luteal phase, it's always reasonably consistent if a woman ovulates. You can expect after ovulation, 10 to 14 days, you will make progesterone. However, the follicular phase, from the beginning of the period all the way to ovulation, that could be highly variable. And it could be 12 days, 14 days, or 20 days and more in some cases. But remember, luteal phase, it's always the same. 10, 12, 14 days max. So there's a certain sequence of events that needs to happen. And to recap from a hormonal point of view, the body first makes estrogen, usually the first 2 weeks of the cycle, days 0 to 14, sometimes 0 to 20 or more. And after ovulation, it adds progesterone. So to make it super clear and simple, hopefully this is a very clear fact that you can get from this podcast. There will be no progesterone without ovulation. Women who use birth control for many years will not make any progesterone for many years. All those years, women are on birth control pills. They will make no natural progesterone. So again, we first make estrogen and then progesterone. So basically, what I want you to take away from this podcast is that if there is no estrogen, there can be no progesterone made by the ovary. The ovary needs to function and generate eggs. In the process of generating eggs, estrogen is crucial. The egg generation ovulation process is the only way a woman will have progesterone made by the ovary. If a woman does not make any progesterone at all, regardless of the estrogen that's circulating in her bloodstream, she most likely will be estrogen dominant. So let's talk a little bit about estrogen dominance and what are the circumstances when a woman at the peak of her fertility or a young girl at the beginning of reproductive life or an older woman at the end of her reproductive life might not make progesterone. So why would there be no ovulation creating estrogen dominance? You might not remember, but in the last podcast, I talked about estrogen dominance and I explained that estrogen dominance is when the estrogen to progesterone ratio is too high for estrogen, in favor of the estrogen. And there's not enough progesterone to balance the estrogen that is produced by the female body. So you might remember that I mentioned there are 3 circumstances in which this ratio could be off. Number 1, you have normal progesterone, but the estrogen is simply too high. Number 2, you have low progesterone, and estrogen could be either normal or too high. Number 3, there is no progesterone, which by definition makes a woman estrogen dominant, and a woman can have either minimal, low, moderate, normal, or high estrogen. If you wonder why I keep bringing up this thing about estrogen dominance, is because estrogen dominance leads to a lot of problems for women. So bear with me. I will talk about it in detail. What are the circumstances or the imbalances that could create estrogen dominance? So let's go over them and discuss them based on a woman's age. First of all, let's chat about why a young girl, not a woman, might be estrogen dominant. Well, if the girl is young, anywhere from 11 to 18, this is really the beginning of her menstrual cycles. It is not unusual at all that her brain to pituitary to ovary communication and connection, what we call HPO axis in the medical world, the hypothalamo pituitary ovarian connection, is actually not mature. So she will likely not be able to ovulate, or if she ovulates, it will be really randomly and inconsistently. This is actually normal, and it is part of the growing up phase. It is not unusual for a young woman to experience heavy periods because they're not ovulating. So there's a lack of progesterone. So let's touch bases and take a little side note here and discuss why are periods heavy if progesterone is low. And let me answer this question with a quick metaphor or analogy. And then we'll come back to why a young woman could be estrogen dominant. So why are periods heavy? Imagine the lining of your uterus is a brick wall. The bricks are the estrogen, and the mortar is the progesterone. If there is no estrogen, there are no bricks to build the wall. So there is no lining growing inside the uterus. Hence, the woman will have no bleeding and no periods. Now, the opposite of that is there's a lot of estrogen. So a lot of bricks on top of bricks will build a very tall wall. The higher and taller the wall, the more noise it will make when it crumbles down. So the thicker the lining of the uterus grows, the more bleeding a woman will experience when the wall finally crashes and the period starts. So I told you earlier, progesterone is like the mortar that solidifies the wall. Progesterone acts on the uterine lining exactly how mortar acts on the brick wall. It stabilizes the wall, stops it from growing, and ensures a timely crash or crumble, which is the period. And it always happens around the same time every month, because if there is no embryo implanted into the wall, which is the uterine lining, the wall will crumble. So hopefully this analogy is simple and easy to understand, because women think progesterone makes them bleed, especially when we give it to them to induce bleeding. But it's not progesterone that makes them bleed, it's actually estrogen. I hope this makes sense, but I'll come back to it a little bit later. So let's come back to what other circumstances there are in which a young woman can be estrogen dominant. So I mentioned the most likely is that the brain pituitary ovarian communication is not mature enough. So there's no ovulation. So like I explained earlier, without ovulation, there is no progesterone. So how can we help young girls that are not yet women in this specific situation? Well, first, as a parent, grandparent, big sister, a friend, you need to know what is important to detect the problem. You need to know the signs. A young girl will not have regular monthly periods and instead will skip weeks or months at a time. Or another sign is the periods are very heavy and they could be very painful. Remember the wall analogy, the taller the wall, the thicker the lining, the more bleeding with the period there is. And if the flow of the bleeding is heavy, clotting and cramps could be very common. So please recognize these signs and act on them. Make a consultation with a doctor if your young daughter, sister, granddaughter, niece, etc. skips periods or has a very long, very heavy and painful period that keeps coming. This is a sign of estrogen dominance, low or absent progesterone. So let's say such a young girl presents to a doctor's office. So what should the doctor do? Well, actually, that's not the right question. What do doctors actually do? As physicians, we have two options. We either replace or treat the young woman with progesterone, or, and this last one, option 2, is used by most OBGYNs, start and recommend a birth control pill or an IUD more modernly with progestin only, like Skyla, Kylena, Mirena. None of these number 2 options are ideal, and they're not really addressing the root cause. But they're not wrong, as a young woman over the age of 16 in the United States has a very high chance of being sexually active and needing contraception anyway. So as a physician, you hit 2 birds with 1 stone. You stop the ovary from producing estrogen, so there will be no more estrogen without progesterone, and you also help prevent an undesired pregnancy. Obviously, if a woman is left untreated and estrogen dominance due to lack of ovulation starts at an early age and is not addressed, it would lead to significant and serious problems like endometriosis, adenomyosis, which is endometriosis of the uterus, ovarian cysts, fibroids, dysmenorrhea, or PMS, premenstrual syndrome. If a young woman is not sexually active, progesterone replacement can be considered, and it's a very good option to address estrogen dominance in these very young girls. We just have to wait for them to mature their brain pituitary ovarian connection, and there's not much we can do except help them with some progesterone. So we talked about estrogen dominance in young women. Let's talk about what could be the most common circumstances in which a mature adult woman will not ovulate and become estrogen dominant. And keep in mind, many of these also apply to the young girls that are under 18 as well. The number one cause for estrogen dominance in a mature adult woman is PCOS, or polycystic ovarian syndrome. This specific situation creates an estrogen dominance environment because the majority of women with PCOS do not ovulate consistently and regularly every cycle. These women also have a hyperandrogenic environment, too much testosterone, and that's manifested with acne and oily skin, possibly thinning hair around the hairline. The androgenic environment, which is higher than normal testosterone, does not allow a single dominant follicle to develop and proceed to ovulation. Instead, a lot of tiny, immature follicles, what we call antral follicles, are recruited, but none of them matures into an egg. These follicles keep releasing estrogen in smaller amounts than the usual large amount a dominant follicle will release, but this lower level estrogen is persistent and occurs for many weeks, sometimes 6 to 12 weeks, and is not balanced by any progesterone. A woman with polycystic ovaries usually has irregular periods, skipping 1 to 2 to 3 months at a time, sometimes 6 months at a time. And when the period comes, it floods. Women with polycystic ovaries might have a period every month, not necessarily because they're ovulating, but because the amount of estrogen that is produced by those little cysts is sufficient to actually grow a lining inside the uterus, which grows big enough to shed regularly, giving the impression of normal monthly cycles. So we talked about the brick wall and the mortar, and I explained that the brick wall needs the mortar to be stable. Well, why does the lining shed if there is no progesterone? Because estrogen has a growth-promoting, proliferative effect. So the lining keeps getting thicker and thicker and thicker with estrogen only. Will eventually outgrow the blood vessels that actually feed it, and it will start breaking down and then shed completely. This periodic shedding of the lining, even though it might occur at 4 to 5 weeks, gives the false impression that a woman has normal cycles, but she likely does not. And the telltale signs are periods that are being slightly or moderately inconsistent in flow and inconsistent in length. So, for example, periods are coming closer together every 21 to 25 days instead of the 28 days, or they're coming much later than normal every 32 to 60 days. Another telltale sign is when heavy periods alternate with lighter periods, or having just light periods all the time. That literally means the lining grows either very little, because there's very little estrogen to make it grow, or it grows very heavy, and it varies from cycle to cycle. Some of these women also suffer from PMS. That's another sign. And all of these women can benefit from progesterone, especially if they're trying to get pregnant. Another big cause and reason for why a woman might not ovulate, even though she has achieved maturity of the brain, pituitary, ovarian axis and communication, is stress. Yes, stress is the enemy of good hormone balance. I'm going to repeat that one more time. Stress is the enemy of good hormone balance. Stress releases cortisol, and the adrenal requires certain steps in the production of cortisol, starting with cholesterol. Somewhere along the way, progesterone is an actual source of cortisol that the body can use and will use to make more cortisol, especially when there's a higher need for it. Remember, I said earlier, in the chain of production of cortisol, progesterone is a precursor hormone for cortisol. That was back in the introduction for hormones when I talked about the adrenal. For years, functional medicine doctors have postulated that the need for cortisol due to stress steals the progesterone made by the ovary that is required to balance the estrogen to maintain a normal uterine lining. and support implantation of the fertilized egg. It's possible that some of it is true, but what's more important is that stress directly inhibits ovulation by literally working on the brain and the pituitary and causing hormone imbalance. Like I explained in a previous episode, ovary needs regulatory control from the brain and the pituitary gland. The drive that comes from the brain, the stimuli, are in the form of a hormone called GnRH, gonadotropic-releasing hormone. And this hormone is crucial because it tells the pituitary gland to make FSH and LH. These are the two hormones that are like the reins controlling the ovary, which in this scenario would be a horse or horses. Imagine a driver sitting on a cart pulled by horses and using reins to tell the horses where to go. The driver is the brain. The horses are the two ovaries. The reins which the driver uses to control the horses are the two pituitary hormones, FSH and LH. FSH is the follicular stimulant hormone. And as the name indicates, follicular, it stimulates follicular development. In other words, the formation of follicles, which are those little cysts on the ovary that turns into eggs and then babies. FSH equals estrogen production. LH is the luteinizing hormone, and it stimulates the release of androgens from the ovarian tissues around the follicles. LH equals testosterone production. The body has to have an exact and perfect balance between these two hormones in order for ovulation to happen. If for some reason the LH drive is too high, then the ovary will make too much androgens or testosterone, not allowing a healthy ovulation. This is exactly what happens in PCOS. So in conclusion, stress directly influences GnRH release from the hypothalamus, the brain, to the pituitary, which means that in the metaphor scenario where the brain is the driver of the horse-driven cart, if you have a very distracted or tired driver, the brain, the reins, FSH and LH, will be all over the place. And the horses, in our case the ovaries, will not move or will be very confused and do weird things, like make cysts grow a lot, fail to ovulate, make too much testosterone, not enough estrogen, etc. I'd like to address a different form of stress, which is specific to young women. Intense and strenuous exercise. For women who are athletes, ballerinas, also applies to any young women who play sports competitively and train a lot, perhaps to get a scholarship for college. These young women and adult women are usually very fit. They have very little body fat. In this case, the brain effectively shuts down the pituitary hormones, so the driver drops the reins, and now the horses literally don't go anywhere. They would just chew on the grass that's in front of them. This translates in the ovary not making any estrogen. And obviously, without estrogen, we already talked about this, there will be no progesterone. It is very common for athletic women to not get a period, sometimes for many months in a row, and sometimes for years. Well, if you were an athlete and training for competition, you wouldn't want to be on your period when it really matters. That's a major inconvenience. Might affect performance. So using a low-dose birth control pill and skipping placebo pills allows women to avoid a period for many months. And many women take advantage of this very convenient side effect of messing with Mother Nature and our body's biology. What are other circumstances outside of stress that interfere with the brain control over the ovary? Well, it's not just stress. And you guessed, severe anxiety, depression, and various mental illness will commonly interfere with the normal brain function and will affect the normal release of the gonadotropic hormone that tells the pituitary to make the FSH and LH. This whole connection is impaired. This is the case when there is no one driving the cart, and without a driver, the reins are useless. The horse, the ovaries, will not move, as they will not have direction or impulse to do anything from the driver, who is, let's say, asleep. Eating disorders like anorexia and bulimia can interfere with this mechanism of control. In a nutshell, all mental and mood issues are known to interfere with normal cycles, and this is how they do it. Another really big, important, and very frequent cause of estrogen dominance is excessive weight gain, obesity, and insulin resistance or prediabetes. All these circumstances are typically accompanied by a high androgenic environment where there is too much testosterone, which unfortunately will create excess estrogen. In a previous episode, I discussed how testosterone is converted by aromatase enzyme, an enzyme present in the fat cells, into estrogen. So testosterone converts into estrogen due to this enzyme aromatase in the fat cells. This process is more pronounced the more fat cells we have. So in obese women with androgenic environments, there's plenty of testosterone, there's plenty of adipose cells, fat cells, so there will be plenty of circulating estrogen. This will send signals to the brain to downregulate, which is a fancy word for inhibit or decrease, the natural ovarian production of estrogen, without which ovulation will and cannot happen. So now we have high estrogen, no progesterone, and high testosterone. Not a good situation, especially if it goes on for the majority of a woman's life and it's not addressed. All our hormones are interconnected. I did mention this in the first podcast, Introduction to the Body's Hormones. So other hormone issues can and will affect the ovulation process and having a normal period. So let's talk about thyroid, for example. A thyroid problem can interfere with the normal menstrual cycle and the release of hormones from the pituitary. It will prevent ovulation and will create cycle disturbances. A deficiency in thyroid hormone will not only prevent and interfere with normal ovulation, but will also increase risk of miscarriage and interfere negatively with normal baby development. Another hormone is prolactin. I mentioned it in the first podcast. It's a very important hormone made by the pituitary gland, and it supports healthy lactation in women. Unfortunately, not that rare, the pituitary part of the gland that makes prolactin develops little tiny benign tumors. Those are called prolactinomas. The growth of these tumors can disrupt the FSH-LH release, and that will prevent ovulation from happening, creating cycle disturbances like loss of periods for many months. What's typical is that these women will many times leak milky white discharge from their breasts in the absence of breastfeeding a child. Not a whole lot, very little, but that's a worrisome sign, so please consult a physician and have your prolactin checked if that's the case. What other hormones are important and affect ovulation? Cortisol. We talked about how high cortisol caused by stress can interfere with the normal ovulatory process. I'm not going to go over this again. And last but not least, there are a bunch of medications that interfere with the brain control over the normal ovarian function, preventing ovulation. Well, the most common one that we women use a lot throughout our reproductive life, it's birth control pills. But you might not know that antidepressants, antipsychotics, even some antacids and blood pressure medications can interfere with ovulation and cause problems with the cycles. So at the beginning of the podcast, I mentioned there are two sources of progesterone in the body. The ovary is the main source. And then the second source, it's a very small amount, but always constant, regardless of whether there's ovulation or not. It's produced by the adrenal gland. The adrenal gland makes a bunch of hormones. And interestingly enough, progesterone is one of them. As a matter of fact, progesterone is a key prohormone in the chain of events that leads to formation of cortisol, our stress hormone. The adrenals make a small amount of progesterone constantly, but remember, very little, as nothing like the amount that's required to balance the estrogen or to allow for fertility or to maintain a pregnancy. That is only what progesterone made by the ovary can do. So to recap and make it simple, the adrenal makes a very small daily amount of progesterone that's involved in cortisol production. It's a prohormone, a hormone made in the process of making other hormones that's used to make other hormones. And then we have a significant large amount of progesterone made by a fertile woman. And again, when is a woman fertile? During the ages of 12 or whenever they get their first period, and the age of somewhere between 40 and mid-50s. This is the progesterone made by the ovary. The actual progesterone involved in balancing the estrogen effect on the uterus and breast, the progesterone that maintains and allows fertility and pregnancy. So we talked a lot about basic stuff about progesterone. What I'd like to end the podcast with is discussing the benefits of progesterone for a woman. Why did I take so long about telling you how it happens, why it happens, and why do we have progesterone? We need to balance estrogen, that's correct. But progesterone is a master key sex hormone. Very important, not just to balance the estrogen that's being produced or replaced, but progesterone has many, many, many benefits. It is a calming and relaxing hormone. It helps anxiety, and it introduces and enhances the sensation of calm. Progesterone can help a woman sleep longer and deeper, and can help a woman fall asleep faster. What you might not know is that progesterone taken orally does cross the blood-brain barrier because it's metabolized in the liver into a product called 17-hydroxypregnenolone, which crosses the blood-brain barrier, promoting GABA. GABA, aminobutyric acid, is the major neurotransmitter that's calming, relaxing, and released during sleep. Progesterone also helps support healthy bones. And most importantly, helps support a healthy breast tissue, most likely providing protection from the proliferating growth-like effect of estrogen. So it actually can decrease risk of breast cancer. People have written books about how progesterone helps women. It has many benefits. If your body does not make enough progesterone, ideally your doctor would need to understand what is happening with your ovarian function. What is the egg quality? Is ovulation happening or not? And how high is your estrogen? Please ask the right questions and keep in mind, progesterone is likely one of the first sex hormones to start declining as a woman ages and approaches perimenopause, right alongside testosterone. Estrogen will always disappear last. So for 2 to 5, sometimes for 10 years, women will be estrogen dominant before menopause. I am literally sad and disappointed that women are not educated or informed about the benefits of this hormone and how important it is. I'm also disappointed in how few physicians use it in their day-to-day GYN or OB practice. In young women that are not sexually active or do not need contraception, progesterone can be used to regulate cycles, to relieve heavy and painful periods, and to help PMS. In women of fertile age who desire a pregnancy, progesterone can be used to enhance and support normal optimal fertility, regulate menstrual cycles, and alleviate symptoms like PMS, heavy painful periods, or irregular periods. Progesterone support and replacement can be used to prevent recurrent miscarriage, to help sustain a pregnancy for the first 3 months. And progesterone has also been used to decrease the risk of preterm labor in women with a short cervix, that small barrel-shaped structure that is sitting at the end of the vagina and at the entrance of the uterus. In women at perimenopause, progesterone can be used to help sleep disturbances, relieve mood problems like anxiety, irritability, PMS, even PMDD. In women of all ages, progesterone can be used to balance estrogen, to regulate their periods, and help relieve their painful and excessively heavy periods. You should also know using progesterone can help breast health and alleviate some of the breast tenderness that afflicts many women in their 1 to 2 week period before their menstruation. And last but not least, in menopausal women, progesterone can be used to help support healthy bones, promote good sleep, relieve anxiety, and help support a healthy sexual function even in the absence of estrogen. There are women who prefer not to use estrogen and are happy just using progesterone. In conclusion, progesterone is a wonderful master hormone that is underutilized in women's health. I will stop here and continue next week with more facts and hopefully wowing you more about progesterone. But if you take anything from this podcast, please remember, this is a key hormone to maintain healthy sex hormone balance in any woman that makes estrogen regardless of age. Thank you for listening, and I'll be back next week. If you liked the information you heard and you'd like to hear more, please subscribe and follow my podcast. Should you find the content helpful to not just you, but possibly others, please share it and feel free to leave us a review. You are welcome to join the Facebook group, The Warrior Optimizing Wellness MD. I certainly hope that you've heard many things in this podcast that made you go, wow, I did not know that, or wow, I'd like to know more. So keep listening and I'll keep talking.